We're putting work groups together, and Jody, Lynn, we want to try to support some of the work that she's been doing, 'cause she's kind of been out there, and so we wanted to do several different work groups and have people sign up for, like, citizen scientists to do baseline studies, to do a working group on the pipelines and so forth. So as we get organized here, we'd like you to, if you know people who might be interested in coming forward and working on some of these in some of these groups with us, we really appreciate it. And next up, we're going to have Peggy Breault speak. And Peg is doing a presentation, Too Dirty, Too Dangerous, on the health issues associated with fracking.
Hi, how are you guys? So I like being associated with something that's too dirty and too dangerous. None of which apply to me. So anyway, I'm a registered nurse. I've worked in cardiology for the last 40 years in coronary care units, in research, the last 20 years in cardiac rehab, and then in a cardiology practice as a cardiology care manager. So I have lots of health care experience. I've also had asthma all of my life, so I've always been very sensitive to the environment, to pollen, to ozone, to smoke, and all of those things. And so for all of those reasons, I'm really interested in this and would like to share my opinions on this. So I'm with a group called 350, and we tried to get a solar energy bill passed this January in Santa Fe, and we didn't succeed, but we hope that it will in 2 years. But at the hearings, I told the senators how, as a nurse, I had watched people die because nobody recognized scientific contributions to the study of the effects of cigarette smoking on people. And over 40 years in that business, I saw many, many people who started smoking thinking that it did not affect your health, and they ended up dying of lung cancer, heart attacks, or suffering mightily because of all of those things. And I'm really afraid that at this juncture in American history, we are making the same mistake with climate change, that it is now an emergency that we can no longer ignore. And so I'm going to go over some of the health facts related to what we know to this point about fracking. So fracking is a relatively new phenomenon. It takes years and years for scientific data to accumulate about the effects of chemicals on the human body. You'll hear a lot about asthma because people like myself, I've always said we're like the canaries in the coal mines. You know, they used to put the canaries down, the canary died, it wasn't good for anybody else. So I think asthmatics function in a way for society like that. Young babies, expectant mothers also are among the first people to feel the effects of these things. So there's clear increases in asthma and allergies throughout the country. 1 in 12 adults now has a diagnosis of asthma, 1 in 11 children. The cost of asthma is about $1,000 a year per child. It's actually much more expensive than that. I mean, the inhalers are $100 to $200 each. I'm pretty healthy, and I buy 2 inhalers a month. 9 people die a day of asthma, and there's been a 15% increase in the incidence of asthma in the last 10 years. So in 10 years, the incidence of asthma has gone up 15%. It's not like there are huge diagnostic improvements that have made those diagnoses possible. Fairly easy to diagnose asthma. You're either short of breath, coughing, or wheezing, or you're not. It's not a complicated illness. So anyway, these are all the reasons that I'm glad you're here tonight, and we need to get going in New Mexico. So last time I did this, I'm not used to speaking in front of big groups of people. So which way do I point this? There we go. There you go. So we do have oil, we do have gas here in Albuquerque and in New Mexico. We also have a lot of sun and wind. Sun and wind are very viable alternatives to fossil fuels. And they're actually cheaper now on the open market than fossil fuels are. We have great potential to have renewable resources. We have renewable resources in New Mexico. We have great potential for economic gain in this state if we utilize our sun, our solar power, and our wind. Zero emission on climate pollutants, Zero fuel combustion, vulnerable populations such as old people, young people, and asthmatics are protected, and jobs are created. Using fossil fuels, we won't get there, and that's a whole other story, but climate change is with us. At the last talk I gave out here, I came up with a great line. I mean, we're not supposed to say climate change in the new administration. And I said, you know, my parents didn't believe in saying sex, but they had 4 children. So I think that climate change isn't about that. We're at about that level with climate change now. What's the problem with natural gas? It's dirty. It's toxic to air, water, land contamination, especially from fracking. It's too dangerous. It's much more. It has much more of an effect on the climate than even carbon dioxide does from automobile emissions. It's just a disaster. Climate change endangers health and truly the survival of the species as we know it. Climate change endangers food supply, our environment, our cities on water, our cities on rivers. It just goes on and on and on. So that's a whole other story, but that's the truth. What's in fracking fluid? So some of the things that we know are in fracking fluid are carcinogens such as benzene, toluene, and arsenic. Neurotoxics, ethylene glycol, which is antifreeze, and lead. Endocrine disrupting chemicals. So endocrine disruptors, so we all know about estrogen and testosterone, but the body is much more finely tuned than that, and there are numerous hormones in our body that are affecting every aspect of our survival, and these chemicals can do this. One of the things I wanted to say also is that we see these effects first in people with lung disease, babies, pregnant women, but it doesn't mean that the effects aren't being taken in by other people. It just takes a lot longer to develop cancers and other illnesses. So it's not just limited to asthma, but fracking hasn't been around long enough to really prove that, except that these are known carcinogens and these are used in fracking fluid. And with the fracking fluid, certain part of it can be proprietary business information, which means that we don't know what's in it. So they've got that patented, it's all tied up, it's a secret for the business. So there are other chemicals in it that we don't know. And you know, these are chemical mixes that we're putting into our environment, into our water, and into our air, which goes into our bodies, that have not been accounted for. You couldn't do this with drugs. You know, I've participated in drug studies, and it takes years and years to get a drug passed by the FDA, thousands and hundreds of thousands of dollars of money and hundreds of patients, but fracking, they can just start doing that without calculating the effects on human health before they do it. Contaminates large volumes of water. Wastewater can contain naturally occurring contaminants such as salts, radioactive materials, heavy metals, PAHs, and volatile organic compounds, which are things that are breathed in, the volatile organic compounds. Volatile organic compounds are emitted across the natural gas supply chain. So when they're putting the thing in the ground, when the gas is coming out, when it's being transported, when it's being put somewhere else, some of this gas is being lost. It's not an airtight system. They contribute to the formation of ground-level ozone and can cause irreversible lung damage, significantly increased risk of premature death. Particulate matter. So any fracking well can involve hundreds of trips every day, especially when they're bringing it up. One of the problems with fracking is that it's terribly stressful for communities because these big semis are going back and forth with water, taking things in, taking them away. So there's a lot of particulate matter, especially in New Mexico where everything is so dry and the dust is being kicked up. When you see those clouds over Albuquerque in the morning, I live on the west side too, a lot of that is particulate matter. You'll see it, you know, after dust storms. There's been particulate matter. We've had moderate particulate matter in Albuquerque over the last month or so. I called to find out why, and so far haven't gotten an answer, but I'm hoping to get that answer. But it's not good for you. Particulate matter not only causes lung disease, but it also contributes to heart disease and heart attacks. what science shows, dangerous exposures. So this is scientific data. These other things were risks. We know there's risks associated with it. There are now some definitive studies coming out that show that there are clear risks between living near fracking wells and illnesses. It's also clear that if you live in a state where there's fracking, that you will also suffer the health consequences of that. So even though in this area we haven't had that much fracking to this point, we have it in our state, and we have that huge methane cloud hanging over our heads. And so this is a problem for us already. So in Utah, and I looked this up, has anybody been to this place, Utah County? I looked it up, how do you say it? It's like Junta or something like that. Anyway, they found dangerously high levels of volatile organic compounds in ozone. In Colorado, these are our sister and brother states, I guess. Dangerous airborne levels of benzene, and again, benzene causes cancer. Excessive amounts of ambient benzene and carbon disulfide in Texas. Statistical association between proximity to a natural gas well, that is, being within a 10-mile radius of a gas well, and congenital heart defects, also prematurity in babies. Prematurity, of course, is associated with some amount of mortality and sometimes lifelong defects in terms of usually learning. More science. Are the EPA air standards strict enough? Air standards don't account for the long-term health effects, risk of episodic spikes in contaminants, and enhanced risks of especially sensitive populations, such as pregnant women, young children, and the elderly. So that's it. Any questions?
Unusual increase in postpartum morbidity in the state. Yes, and they can't account for it. They don't know why. And one of our legislatures wanted to introduce legislation to study that within a year, women are dying and they're not, they don't know why. There's like a 25% increase.
I always tell people I grew up in a post-war Irish Catholic neighborhood in Chicago. I was the only kid in the neighborhood with it. I had 25 first cousins on one side, didn't count the other. I was the only kid with asthma or allergies or anything, and now everybody's kids have it. It's just frightening.
These are the mothers that are
well, yeah, but I'm saying it's just this kind of, you know, it takes years to figure out why this is. Again, we've had a 15% increase in asthma in 10 years. But what you're telling me is more frightening. That's just horrible. And is there infant mortality associated with the mother?
It wasn't mentioned.
Okay. All right. Well, thank you. Thank you.